as we get ready to wrap the show up for today, let's discuss, Miss Pascasio. How can people support this great project? How can people living here support what you're doing?
Well, they can support it in many ways. Of course, we always could use funding because we always need to buy medication. We maintain a fairly large inventory of medications for patients. But more importantly, the children. They are so happy when they have coloring books and coloring pencils. Right now, I was initiating a campaign to see if we can get like small DVD players for them.
Okay.
Because when they're taking their medication, it's a kind of a diversion therapy.
Yes.
So, I was trying to see if I can get 4 or 5 DVD players that people don't want anymore because they could use them down there. The other thing is individuals who are changing their phones, if they would like to donate their old phones, we would take them because we have patients who live in remote areas and have no way of communicating when they get sick. And what we would do is we get the phones, and then we would get donation to buy minutes and put them on the phone, and then they can call the nearest health center or call us when they're not feeling very well.
Okay.
So those are 2 things. We are looking for things like a pediatric vital sign machine.
Okay.
But I have to tell you that most of our support, surprisingly, comes from inside Belize.
Oh, okay.
We thought otherwise. We thought, okay, well, we Belizeans in the United States will be very helpful. No, the majority of our support for the Cancer Center and the cancer programs are coming from inside the country.
Well, it goes back to awareness. So we're hoping that now by using this media source that maybe people will know about what's going on.
We hope so. We are growing. The Cancer Center has been, it had its 5th birthday on October the 1st.
Okay.
Yes, yeah. And we have seen, I believe that we've had about 1,500 visits to the Cancer Center. We, on our roster, we call it the Master Patient Index, we have about 695 individual patients that we've seen.
Wow.
Over the last period of time. And we get new referrals every time. There are some patients who self-refer. They were given a piece of paper that says you have cancer, and they come to the Cancer Center and say, what do I do with this? So the one important thing for people to hear is we do not turn a patient away that has cancer.
Okay.
It really doesn't matter how much money they have. We do ask if they can. They provide a donation. But we know, and the donation is simply to help somebody else who does not have it.
Okay.
But we know that cancer treatment is expensive.
Yes.
But if you have a diagnosis of cancer confirmed, and you come to the Belize Cancer Center, you will get treatment.
Okay, well that's good to know. So no one is turned away.
No.
So are you ready to get in the kitchen and get into that potato salad?
I have not made a potato salad for so long. I am dying to just get into the kitchen and do that.
All right, see?
Yes.
Wow.
Especially since I hear that there's secret ingredients, and I love secrets.
Well, see, I know that you will have a great time here this afternoon.
Yes, I know I will.
And I feel so blessed to have you here, sharing what you're sharing, because this is very, very important.
Well, I have to tell you that we find that the more we talk about it, the more receptive people are to it, and Belize being a very small country with limited resources, they have to do what they can, and I must say that although we probably had a rocky start, after 5 years, we're finding a way.
Growing up,
we're finding a way.
And I'm also grateful to say that when they did my biopsy, they found it was...
Oh, wonderful.
There was nothing. I do have the nodule, but...
They will follow it up, though.
Yes.
And we'll
check again.
That's wonderful.
But it was like a 1% chance of it being anything.
Yeah, well, the thing is, if we have access to medical care and we have access to physicians who can do that level of assessment, we should take advantage of it.
Yes.
In lesser developed countries, women die because they have no access. And I think that's what the World Health Organization is trying
Yes.
to do, is to improve access so that you have less unnecessary deaths.
Mm-hmm. Yeah. Because like I said, I didn't even worry. I was like, okay, fine. I'll do the biopsy. I think first I had to do a C scan or something.
Yes, a CT scan.
Yeah.
That's one of the things that we hope as we improve. The First Lady is very involved in this whole issue of the cancer movement, having a personal experience herself.
Yes.
And she has been one of our strongest advocates for improving our cancer treatment program in Belize. We are now in the process of looking at a replacement facility.
Oh, nice.
That is larger, that with full diagnostic capability.
Okay.
And at the end, if we can, the infrastructure can support it, having a radiation center in Belize.
Oh, nice.
That way, it'll really reduce the burden,
Yes.
the economic burden for families who need it.
Yes. And the finances can
Yes.
go elsewhere.
So we have a vision, a one-stop shop vision.
Well, that's good.
Yeah.
I mean, if you don't have a vision,
There
the
you go.
people will perish, right?
Yeah, we're hoping that the people will celebrate.
Exactly. That is definitely comforting. And like I said, I applaud you for all your hard work. And we hope that this conversation today has caused an awareness that will allow other people out there to find it in their heart to assist with this project.
That would be wonderful.
Okay. And now, folks, we will go into the kitchen and we'll work on the potato salad. Thank you. We'll be right back.